My name is Dr. Ajay Gupta. I'm a family physician here in Austin, Texas. I'm one of the medical directors here for the Infusion Center here at the Jefferson Street Family Practice. We were approached to start an infusion center at our practice approximately 3 to 4 years ago. Prior to that, the patients that we were seeing in the office that normally we would have sent to the emergency room, we are now sending to our infusion center. Patients that, for example, are receiving things like IV fluids or IV antibiotics for cellulitis and dehydration, even conditions like pneumonia, diverticular disease, we've treated here in the infusion center. And for the patients, it's been a welcome addition to our practice. Instead of having to go to an emergency room where they incur a much larger waiting time, and a much longer waiting time, I should say, as well as a much larger bill, they've been seeing us under the tent of the family physician's office. So our patients have been very excited and have been very appreciative of such a service. The other thing that's also been helpful for the patients is, you know, for the ones that we've been treating for say several days of antibiotics, such as for pneumonia, they're able to, you know, go home and sleep in their own bed and make an appointment to come back the next day for their next treatment for IV. We've seen clinical outcomes that are probably comparable to what a patient would receive while in the hospital, without, of course, incurring the huge hospital bill and the costs that are associated with all that, including time spent away from work and time spent, you know, away from family. I know in certain communities the primary care doctors are still taking care of their patients in the hospital, and we certainly were trained on doing such a thing. But here in Austin, most of the patients are being treated by what's called a hospitalist, which is a doctor who takes care of the patients while they're in the hospital. And what gets lost in the shuffle is continuity of care. When we're taking care of the patient, certainly we're not having to repeat tests, and that also helps with overall healthcare cost. Employers definitely would, I would see, be in favor of such an infusion center. In the end, you know, the employers want to make sure that their employees get taken care of, but lost work productivity is a huge thing for employer groups, and employers knowing that these services are available are something that they would find beneficial to their employees.